So good morning, guys. This is the first session. Okay, and according to syllabus only, we'll cover everything. Almost 30 sessions will take. Okay, and any day if I'm taking off in weekdays, then we'll cover that on weekend. Okay. So आज से शुरू करते हैं हम. फर्स्ट सेशन है तो आज थोड़ा सा बेसिक नॉलेज हम अंडरस्टैंड करेंगे. हेल्थ केयर क्या होता है क्या नहीं, इसके इम्पोर्टेंट जो कंपोनेंट्स है. ठीक है, इसमें क्या क्या हमारा रोल्स रहेगा, रिस्पॉन्सिबिलिटीज क्या रहेंगे, वो सब हम देखेंगे. एज अ एआर हमें क्या क्या करना होता है कंपनी में. ठीक है. और इंक्वायरी सेशन ऑलरेडी हमने लिया हुआ है, बट देन ऑल्सो आई विल गिव यू अ शॉर्ट 2 मिनट. सो गाइज, हम 2020 से ट्रेनिंग ले रहे हैं. हमने अभी तक 45 प्लस बैचेस लिए हैं. हमारे 80 प्लस स्टूडेंट्स ऑलरेडी प्लेस है. दे आर वर्किंग इन मल्टीपल कंपनीज फ्रॉम लास्ट 3-4 ईयर्स. ठीक है, सभी हम ट्रेनिंग जो लेते हैं वो ऑनलाइन मोड में ही लेते हैं. हमारे तरफ से आपको सारे ही नोट्स, इंटरव्यू क्वेश्चन एंड आंसर और आपके जो भी प्लेसमेंट के लिए सपोर्ट रहेगा वो सब कुछ हमारे तरफ से प्रोवाइड होगा. ठीक है, बट यू हैव टू प्रिपेयर, यू हैव टू गिव सम टाइम फ्रॉम योर साइड एज वेल. ठीक है, हम अकेले कुछ नहीं कर सकते, आपको एफर्ट देना पड़ेगा उसमें. ठीक है. एंड एलिजिबिलिटी इस कोर्स के लिए जो भी हमारे पास 2-3 कोर्सेस है, सारे यूएस हेल्थ केयर में एनी ग्रेजुएशन इज रिक्वायर्ड. ठीक है, अगर आपको ग्रो करना है तो बहुत सारे कंपनीज में परस्यूइंग ग्रेजुएशन भी चलते हैं, बट यू कैन नॉट ग्रो इन द करियर इफ यू डोंट हैव ग्रेजुएशन. अगर नहीं है तो आप ओपन यूनिवर्सिटी इधर उधर से जुगाड़ कर लो, बट ग्रेजुएशन इज मस्ट इन बिग कंपनीज. ठीक है, मैंने बहुत सारे मल्टीपल एमएनसीज में काम किया हुआ है, तो मुझे वहां पे पता है कि उनके रूल्स है कि ग्रेजुएशन वहां पे चाहिए. यूएस शिफ्ट, यू शुड बी कंफर्टेबल विथ फ्लेक्सिबल शिफ्ट. ऐसा नहीं है कि हर बार नाइट शिफ्ट भी काम करना पड़ता है. इफ यू आर हैविंग इनफ नॉलेज एंड एक्सपीरियंस, देन यू कैन गो एज अ क्वालिटी एनालिस्ट or AR analyst or other designations are there in the every company, so you can go for other shifts as well. Okay, you should have good communication, at least neutral communication, like basic communication you should have able to give the interview and all. ठीक है. वर्क फ्रॉम होम के भी अपॉर्चुनिटीज है, बट दे आर टेकिंग एडवांटेज, दे आर नॉट गिविंग मोर सैलरी. ठीक है, वहाँ पे ग्रोथ नहीं है. वर्क फ्रॉम ऑफिस अगर जाओगे तो आपको ग्रोथ मिलेगा, करियर में डेजिग्नेशन में आप जा सकते हो. ठीक है. एज अ फ्रेशर किसी को ज्वाइन करना है तो वी आर ऑल्सो हैविंग सम टाई अप विद सम कंपनीज, वी कैन शेड्यूल योर इंटरव्यू एज अ फ्रेशर. ठीक है, एक्सपीरियंस भी जाना है तो आपको डेली हम 5 से 6 अलग अलग जगह के ओपनिंग हम शेयर करते रहेंगे हमारे कम्युनिटीज पे. ठीक है. एंड यू शुड बी रेडी टू रिलोकेट फॉर अदर लोकेशन ऑल्सो. ठीक है, लिमिटेड अदरवाइज अनलिमिटेड आपके लिए स्कोप हो जाएगा अगर आप एक सिटी को टारगेट करते हो तो. ठीक है, आप एआर कॉलर जा सकते हो, एसोसिएट जा सकते हो, एनालिस्ट जा सकते हो. एज अ फ्रेशर एक्सपीरियंस अगर जाना है तो भी हम आपको उसमें हेल्प कर सकते हैं. ठीक है. और सेमी वाइज प्रोसेस है. डेली ऑन डेली बेसिस यू हैव टू डू at least 8 to 10 calls maximum as a AR caller. Remaining things can be done using websites, using EOBs by analysis. So it's not the pure callable process, and best thing is we are not going to sell any product. ठीक है, एज अ फ्रेशर आप ज्वाइन करते हो तो नियर टू 20,000 सभी जगह पे मिलता है आज के दिन में. एक्सपेंसेस बहुत है तो 20,000 भी हमें कम ही लगेंगे, बट वी डोंट हैव नॉलेज, देन ऑब्वियसली वी हैव टू स्टार्ट आवर करियर विथ लो सैलरी. दैट्स फाइन, बट आफ्टर 6 मंथ यू कैन स्विच प्रॉपरली by taking reliving experience, and then you can go for next company with good salary. अबाउट 25,000 आराम से मिल जाएगा आपको ऑन द बेसिस ऑफ 6 मंथ. ठीक है. Above 1 year experience, near to 35,000. Everywhere we can expect 2 year plus experience above 40,000, and 3 year plus experience वालों को maximum 70,000 तक अभी सैलरी मार्केट में शुरू है. From our old batches like 2020 or 2021, 2022, now they are near to 60,000. Okay. तो इतने सारे डिपार्टमेंट रहते हैं हर कंपनी में अंडर आरसीएम, और आप इसमें से 2-3 डिपार्टमेंट के लिए जा सकते हो. इवन दो यू आर टेकिंग ट्रेनिंग फॉर एआर कॉलर, देन ऑल्सो यू आर एलिजिबल टू अप्लाई फॉर एलिजिबिलिटी बेनिफिट्स वेरिफिकेशन, प्री ऑथराइजेशन, ईडीआई एंड द डिनाल मैनेजमेंट एज अ एआर. Okay, because they knows that you are having knowledge about the process, then you can easily grasp the knowledge and you can work on that. ठीक है, तो इजीली आप 4 डिपार्टमेंट को जा सकते हो. दिस इज अवर सिलेबस एंड अकॉर्डिंग टू सिलेबस ओनली we'll take our your sessions. So this is the first introduction part where we'll see overview of US healthcare, revenue cycle management, responsibilities of AR. Then we'll see CMS 1500 form and terminologies. All these things cannot be possible in a single day. Maybe it will take 3-4 days. Okay, but this is the module one. This is module two where we are completing terminologies, and then we'll see what is meant by network, out of network, and the global period. Then detail we will see the EOBs, and we are not covering here only theoretical, but we'll see a live real EOBs in the application in the Avality website, and we are also having some access for other insurance websites. So we'll show you everything practically, so you don't have to worry about and you don't have to imagine more things. Okay, everything will be practical. Okay, also we'll give you some detail about the types of insurances, how many insurances are there, major insurances. And from these topics only, interview questions are there. So in our syllabus and in our notes, we have marked it as a star, double star, and out of how many interviews you can face that question. Probabilities we have marked so that you can give importance for that topic. ठीक है, उसके बाद हम देखेंगे कि मेडिकेयर के यानी मेजर इंश्योरेंसेस के कौन से टाइप रहते हैं, उसमें मैनेज केयर प्लान क्या है. इवन दो वी आर टेकिंग ट्रेनिंग फॉर AR कॉलर, बट देन ऑल्सो विल टेक सम 3-4 सेशंस फॉर कोडिंग एज वेल, सो दैट यू विल गेट अ डीप डेप्थ नॉलेज अबाउट द कोडिंग. ओके, विच इज रिक्वायर्ड फॉर द AR इफ यू आर गोइंग एज अ एक्सपीरियंस. तो कोडिंग भी हम कवर करने वाले हैं. ठीक है, जो 3 year प्लस एक्सपीरियंस वाले रहते हैं उनको कोडिंग का क्वेश्चंस इंटरव्यू में रहता है. सम मॉडिफायर्स दे विल आस्क यू, some other details about the coding they will ask you and you are able to answer for those things. ठीक है, उसके बाद फोर्थ मॉड्यूल में हम यहाँ पे रिफंड रिक्वेस्ट मीन्स क्या होता है, अपसेट मीन्स क्या होता है, रिकूपमेंट मीन्स क्या होता है, ये हम EOBs में भी देखेंगे. एंड व्हाट एक्शंस वी हैव टू टेक, व्हाट नोट्स वी हैव टू राइट इन द सिस्टम. ठीक है, ये सब देखेंगे हम. रोल्स एंड रिस्पॉन्सिबिलिटीज हम यहाँ पे ही देखेंगे, फर्स्ट सेशन में रिपीट हुआ है. रिजेक्शंस मीन्स क्या होता है, डिनाइल्स मीन्स क्या होता है. बिफोर स्टार्टिंग अवर नेक्स्ट पार्ट ऑफ द नोट्स, फर्स्ट पार्ट में ये सब कुछ हो जाएगा. आपको जो नोट्स मैंने ड्राइव पे दिए है उसमें ये जो 4 मॉड्यूल्स है उसका फर्स्ट पार्ट में आपको नोट्स है. सेकंड पार्ट इज प्योरली फॉर द डिनाइल्स, सो ऑलमोस्ट 25 डिनाइल्स वी आर गोइंग टू कवर. टॉप 25 डिनाइल्स विल कवर. ओके, एंड रिमेनिंग डिनाइल्स इजीली यू कैन वर्क इन एनी कंपनी. सो डिनाइल्स, हर डिनाइल के रिलेटेड हम डिटेल में देखेंगे कि रीजन क्या है डिनाइल्स का, उसमें हमें काम कैसा करना होता है, उसमें वर्क फ्लो क्या है, अगर आप काम करोगे तो उसमें सिनेरियोज क्या क्या आ सकते हैं. ठीक है, वो सब डिटेल में हम देखेंगे. और हम प्रैक्टिस मैनेजमेंट सॉफ्टवेयर में हम उसके रिलेटेड नोट्स राइट करेंगे, उसके रिलेटेड एक्शन लेंगे. ठीक है, तो एवरीथिंग विल ट्राई टू डू इन आवर एप्लीकेशन सो दैट आपके दिमाग में वो बैठ जाएगा कि आपको काम कैसे करना है. इवन दो एप्लीकेशन विल बी डिफरेंट बट द एक्शंस एंड द इंटर नोट्स विल बी द सेम. ठीक है, और क्या क्या चैलेंजेस हो सकते हैं, सिनेरियो वाइज इंटरव्यू में क्वेश्चन क्या हो सकते हैं. ठीक है, आपको सॉफ्ट स्किल्स में क्या क्या अपडेट करना है खुद को. ठीक है, इवन दो नाउअडेज AI इज देयर. ठीक है, बट डोंट वरी, यहाँ पे इतना ज्यादा इम्पैक्ट पड़ा नहीं है AI का. ठीक है, और पड़ेगा भी नहीं क्योंकि हर चीज में एनालिसिस अलग है, उसमें एक्शंस अलग है. ठीक है, इन फ्यूचर में भी सम इम्प्रूवमेंट्स विल बी देयर, बट डोंट वरी, लॉन्ग टर्म जॉब है हमारा. ठीक है, नथिंग विल हैपन. इवन दो IT में भी इतना इम्पैक्ट पड़ा नहीं है, बस वो रूमर है. ठीक है, और हम कॉल, हमारा जो इंटरनल एप्लीकेशन है उसमें हमने कॉल स्क्रिप्ट करके एक फंक्शन बनाया है. उसमें क्या होता है कि हर डिनाइल्स के लिए अगर आप कॉल करते हो इंश्योरेंस को, तो इन बिटवीन AR कॉलर एंड द इंश्योरेंस रिप्रेजेंटेटिव उसमें क्या कन्वर्सेशन होता है वो आप वहाँ पे स्क्रिप्ट रीड कर सकते हो. यू कैन क्रिएट अ ऑडियो फाइल एंड यू कैन लिसन सो दैट आपको समझेगा कि कन्वर्सेशन कैसा होता है. ठीक है, आप हर डिनाइल का, हर सिनेरियो का वहाँ पे स्क्रिप्ट जनरेट करके ऑडियो फाइल भी जनरेट कर सकते हो. ठीक है, और आपके हम एक्सटर्नल मॉक भी अरेंज कर सकते हैं इफ यू आर वांट टू फेस like the real time interview. Then I'm having some good network who are really in real time they are taking interview for their company, so we can arrange your interview with them. दे विल गिव यू फीडबैक वेयर यू हैव टू इम्प्रूव। ठीक है। और एक्सेल शीट अगर आपको आता नहीं है तो इट इज वेरी इंपॉर्टेंट। आप यूट्यूब पे एक दो जगह पे, ज्यादा नहीं लेकिन 15 मिनट्स के अगर आप सेशन देखोगे तो एम एस एक्सेल बहुत इंपॉर्टेंट है। आपको बेसिक चीजें आनी चाहिए एम एस एक्सेल की। ठीक है। मैक्सिमम जगह पे टूल्स रहता है बट कुछ कुछ कंपनीज में एक्सेल में ही काम होता है। यू शुड नो अबाउट हाउ टू हैंडल और हाउ टू यूज द एक्सेल फाइल। ठीक है। प्रैक्टिस मैनेजमेंट सॉफ्टवेयर हम हमारे इसमें लेने ही वाले। ठीक है। मॉक कॉल्स के सेशन भी लेने वाले। ठीक है। यू डोंट हैव टू वरी अबाउट हाउ टू कॉल टू द इंश्योरेंस एंड ऑल। ठीक है। उसके बाद HIPAA compliance क्या होता है, हाउ वी आर गोइंग टू फॉलो इन द कंपनी। ठीक है। एंड एट लास्ट फ्रॉम आवर साइड वी विल हेल्प यू टू क्रिएट योर रेज्यूमे अकॉर्डिंग टू योर प्रोफाइल एक्सपीरियंस एंड द गैप इन द करियर। ठीक है। वी विल हेल्प यू टू क्रिएट योर प्रोफाइल ऑन द naukri.com। We will help you to schedule your interview in multiple companies. ठीक है। And also will share you, already I have shared the interview questions and answer. You can continuously go through those material and it's not big thing. तो ज्यादा बैच में स्टूडेंट नहीं है, अदरवाइज हम ग्रुप डिस्कशन रखते हैं। अगर बैच में 10 12 15 स्टूडेंट रहते हैं तो हम ग्रुप डिस्कशन रखते हैं। ठीक है। और ग्रुप डिस्कशन का ये फायदा होता है कि एक्सपेरिमेंट नहीं करना होता है हमें लाइव इंटरव्यू में। तो हमारा ऑलरेडी वहाँ पे ग्रुप डिस्कशन में बहुत सारी प्रैक्टिस हो जाती है इंटरव्यू के रिलेटेड। बट डोंट वरी, आई हेल्प यू इन दैट एज वेल। एक मिनट। 1 second guys। ओके। तो दीज आर सम ऑफर लेटर्स फ्रॉम आवर प्रीवियस बैचेस। ठीक है। आई कैन कलेक्ट सो मेनी बट I have just kept it. Some offer letters from Wipro, Medsent, R1. These are recent one. Okay, I can show you date. You can see here. This is the May 2025, right? And this is Ascent May 2025. R1. Have to check. But good packages. You can see here. Ascent Business Solution. How much they are paying? Okay, as a fresher. Let's see. Huron. You can see 5.17. This is the Omega 3.91. This is the first insight 5.82. Okay, this is also one only. Okay, so some offer letters I kept it just to show for our previous students where they are now. Okay, this kind of certificate will provide you so that you can mention in your resume that you have completed 3 months of AR color training from Career Fountain, and they can do a verification. I'll give you the updated certificate where the email address will be the info@careerfountain.in. Okay, we are having web portal as well. Okay, so anybody want to check your or verify your certificate, then they can do that. Okay, so this was only the inquiry session, and let's start our first session now. Anyone is having any query till now? Deep?
नो सर।
आप कभी भी पूछ सकते हो, नो वरीज। ठीक है। तो यूएस हेल्थ केयर सिस्टम इज अ मिक्स ऑफ पब्लिक एंड प्राइवेट हेल्थ केयर सिस्टम। ठीक है। वहां पे कुछ गवर्नमेंट हॉस्पिटल्स भी है और प्राइवेट हॉस्पिटल्स भी है, सेम लाइक द इंडिया। मेनी मेनी थिंग्स यू कैन कंपेयर विद द इंडिया। ठीक है। इट इंक्लूड हॉस्पिटल, क्लिनिक, डॉक्टर्स, नर्सेस, हेल्थ इंश्योरेंस कंपनीज, गवर्नमेंट प्रोग्राम्स। ओके, गवर्नमेंट प्रोग्राम्स मीन्स गवर्नमेंट की तरफ से कुछ कुछ इंश्योरेंसेस प्रोवाइड होते हैं। ठीक है। कुछ पॉलिसीज रहते हैं। Okay, they are called as a government programs. Unlikely many countries where the government fully fund healthcare. So कुछ insurances है US में जो fully funded by US government only for their US citizens. So this is only the reason 95% plus population in US they are having healthcare insurance, and they are working on this field from last 40 years. And major part of their budget every year they are spending on healthcare only. ठीक है, तो यहाँ पे प्राइवेट इंश्योरेंस के तरफ से अगर कोई लेता है तो पीपल हैव टू पे देयर प्रीमियम एंड ऑल। गवर्नमेंट के तरफ से भी लेता है तो एवरीबडी इज नॉट एलिजिबल टू गेट द गवर्नमेंट इंश्योरेंसेस, and for some government insurances they have to pay a minimum amount. We'll discuss in detail, don't worry. Healthcare services are delivered by both public and private providers. So here provider word is for the person or the facility who are providing healthcare services. It include doctor, nurse, compounder, hospital, ambulance, physiotherapist, everyone or the every facility who is or which is providing health related service. A common word is the provider. Okay. So the system is mainly insurance based, meaning you need health insurance to get care affordable, because in US everything is very expensive, especially for the healthcare. You can compare, I can give you the example as a normal one tooth, like if you want to do the root canal for one tooth, in US it will charge 2000 to $3,000. Okay, it's expensive. In India, we can do it in 10, 15,000. But if you are comparing or converting that $2,000 into Indian rupees, 1,80,000. So that much expensive thing. So it's a small service, right? And for normal checkup also, $300 minimum everybody are charging. Okay, so it's a expensive thing. So that's the reason they are taking insurance, or they are getting insurance from their employer, or they are getting insurance from the US government if they are eligible. Okay, so we'll see which insurances, how they are eligible and all. So four components are important component in US healthcare. They are provider, payer means insurance. Okay, one more name for the insurance is payer, and the patients, that means the policy holder, and the regulators. Regulators are those who are creating, or the we can say as a government departments, they are creating some rules and everybody have to follow those rules. In the US, like in India, RBI is creating the rules for all the banks, and all the banks have to follow those rules. Same thing here, some departments are there, and like the CMS, AMA, we'll discuss that later. So they are creating some rules and everybody have to follow that. Okay, so they are called as regulators. So provider are, just I said, everyone who is providing health related service, they are called as provider. Payer means the insurance companies are called as, another name is the payer, who used to pay for the healthcare services on the basis of whatever plan it is and what kind of benefit it is giving. Okay, patients are nothing but they are the taking the healthcare insurances. Okay, they are consumer, we can say. And regulators, they are the government departments who are regulating or deciding the rules, and they are also monitoring everybody is following those things or not. Okay, some departments are there where people can do complaint and they can take a strict action on those hospitals or the providers if any false or any wrong things is happening. Then strict rules are there. There will be a huge due, and in some cases jail will be there. They can cancel their licenses and all. Okay. So some insurance plans are there, as we are already aware about many insurances in India as well. If you know the healthcare insurance, it is people are taking to cover their healthcare services. If you go to any insurance company, they are having this as a products. Okay, you can buy a product on the basis of your requirement. Okay, we can consider as Bajaj Alliance or the LIC in the India. Like this in US, they are having big insurances like UHC is there, BCBS is there. Okay, like this, so many companies are there. We'll discuss, and they are having these products, and people are taking. So healthcare insurance, people are taking to cover the healthcare medical services. Dental plan are there to cover the dental related services. That means healthcare insurances are not going to cover the dental services. Okay, they have to take such kind of plan if they want to cover dental services as well. Fire insurances is there if especially for uh, go downs or some places where keeping some big things, and they want to take insurance if some incident happen about the fire, then it will cover from the fire insurances. Okay, traveling insurance, we already know that when we are taking any flight ticket or the train ticket, then nowadays it is included in our ticket as well. All right. So same thing in US, travel insurances are there. It will cover if any incident happen, then some amount will get to the family. General insurances, people are taking general insurances to keep their money, to save the taxes, and after some year, 15, 20 year, they will get the bulk amount. Okay, in India as well, we are doing this, right? We are buying some insurances to save the taxes, and so that after 10 year, 15 year, 20 year, our children will get a big bulk amount and all. So we'll do that. Security insurances, if you are keeping some expensive things in the bank or the lockers or such kind of facilities, then we are taking security insurances to protect against the losses, right? And some auto insurances, we know that in India as well, it is mandatory that if you are taking any vehicle, then auto insurance you have to take, and it will cover not only the vehicle but the driver and the next party like who got accident, they are also getting covered into the auto accident. So if somebody is having auto accident, it will cover only accident related services, it will not cover normal services. Okay, so we'll see how it is acting, how it is working. Okay, some other insurances are also there. Worker compensation, it is not mentioned here, but worker compensation insurance is the type of insurance which is provided by employer to their employees, and it is mandatory that if somebody is providing employment, then they have to provide the healthcare insurance to their employees, and that insurance will cover only and only services related to work injury and illness. It will not cover any other illness or injury which is not related to work. Okay, so how to work on those things and all we'll see. Now, at this point, we are not sure for which specialty we are going to work, for which hospital we are going to work, in which company we are going to get the job, for which software we are going to work, right? So don't worry, you will get a training whenever you are joining in any company. As a experience, as a fresher, if you are joining, then you will get a basic training about the application, about the specialty, and what kind of rules and the update tracker and the SOP you have to follow. Everything they will give you training. Okay, they don't want to take a risk with the new employee. And many big companies are having a standard training like 1 month training, 1 month, 2 month training. Okay, if you go to the R1 RCM or the Wipro or the Cognizant, I also work in two companies from this. So they're having standard training for everyone who is having pressure or experience. You have to go through those 2 months training, and then only you can go on the floor and work. Okay, so doctor specialties, we know that some neurologists will be there. So in some companies you will get a specific specialty for which you are going to work, and in some companies the client is multi-specialty hospital, so all the specialties doctors claims will be there. Okay, so if you want to face any interview and they are hiring for a specific specialty like orthopedic, then they will ask you more question about that specialty. But if you are answering like you are working for the multi-specialty hospital, so they cannot ask you a specific question for particular specialty. That's the best answer for us. If somebody is asking you for which specialty you are working, then don't use any specific specialty. Just tell them I'm working on multi-specialty hospital. Okay, so every all the claims are coming: pediatric, orthopedic, general physician, as anesthesiologist, dentist, cardiologist. All the claims are there in our system. Like this, you can say. Okay, which billing type should be used for healthcare charges? So in India, we know that every insurance company, they are creating their own rules. They are creating their own claim forms. Okay, so they are having their own system to get paid to the policyholder. But in US, it is not like that. US government has created multiple rules, and here two major claim forms are there. Some more claims form are also there, but from this, the important thing I have picked, that is one is the physician billing and the other is the hospital billing. In India also, if our family member or our friend somebody has admitted into the hospital, and they are admitted for 1 week, 2 week, then we'll get one file and all the reports are there, bills are there together itself, right? But in US, but in US, they have segregated two into the two things. One is the physician billing, another is the hospital billing. So whatever doctor's charges are there are coming under the physician bills, and whatever hospital charges are there, room charges are there, equipment charges are there. So those are coming under the hospital bills. Okay, so two bills they are generating, and for these two bills we can send a separate claim form to the insurance company. Okay, for physician billing we are using CMS 1500 form all over US. Any specialty, if they want to send a physician charges, then they have to use the CMS 1500 form, and all the insurance company have to accept the CMS 1500 form only. They cannot generate their own claim form. That's the rule. Okay, we'll say we are having a separate session for CMS 1500 form, because in this training we are going to focus on physician billing, not on the hospital billing. But don't worry, even though we are having physician billing knowledge, we are eligible to apply for hospital billing clients as well. Okay, they will give you a 1 month training, and you can work for hospital billing. They know that. Okay, both the things are same. Only the claim form and the procedure codes, some coding part is changing, but the work style will be same. Okay, so here US government has created a standard rules and claim forms which needs to be used by every healthcare provider and insurance company. Okay, so here every insurance company, sorry, every client, every provider, they are using some of the one of the practice management software. Everybody is digitalized in US nowadays. Okay, so electronically, uh, how we are going to send these claim form to the patient's insurance company. Okay, consider that you are working for a multi-speciality hospital where 100 plus patients are coming every day. Okay, and we are having two bills. One is the physician bill and another is the hospital bill. And we want to send it to the patient's insurance. And from that 100 patient, almost 40 different insurances are there. Okay, so we are going to deal with every insurance company, whatever insurance company it is. So first of all, hospital is only responsible to do deal with the patient's insurance, whether they are contracted with that insurance or not. Okay, so it is our provider's responsibility to send the claim form and to get the payment from the patient's insurance. Okay, so multiple departments are there under the medical billing or the US healthcare, and we'll see that into the RCM cycle to understand each and every department's work and the roles and responsibility, what exactly they are doing. Okay, so nowadays everybody is digitalized, everybody is using one of the software, and they are maintaining the patient's medical record, history report, everything. Okay, and the common name is the practice management software. Okay, if you search the list of top practice management softwares, you will get so many softwares. Okay, we also have created our own practice management software just for training purpose, so that you don't have to imagine everything. Okay, so we'll cover everything in our internal practice management software. Okay, and these practice management softwares are highly payable, means highly rented application. They are not free of cost. If you are using any practice management software under any client, they are paying 300 to $1,000 per month per user. That much charges are there. So big clients are creating their own practice management software so that they can save future money. Okay, I also work for big clients in my past companies. Okay, one of the client was Med Synergies. It's a big client, 20,000 plus doctors are there under the single roof. Okay, they are having multiple branches in multiple cities and state in US. So you can imagine that 20,000 doctors are working under that client. So how many claims are there in the inventory, right? So they cannot pay these many licenses. They cannot take these many licenses of the software, right? So that's the reason they have created their own application, and we were everybody was using the single application, which was internal application. The top applications in many job openings, you can see these names. They are going to prefer, if you are having knowledge about the next gen, Epic, ECW, Advanced MD, Cario, Athena Health. Okay, and some companies are there, they are Indian companies. They have created the application and they are selling it, or they are giving on the rent. So ECW is the Mumbai based company. Okay, it's an Indian company. They also grab so much percentage in the US. Okay, so many providers are using ECW. Okay, and these companies are present in India, their offices. Many times you are seeing openings in the Athena Health. I also having some friends who are working in Athena Health Chennai. Okay, in ECW Mumbai. Okay, these companies are having openings. Okay, not they are not only selling the application, but they are also handling the medical billing part. Okay, some more applications are there apart from the practice management software. So that is called as EDI software, electronic data interchange, also called as clearinghouse. So directly from our application, claim form is not going to the insurance. There is a mediator application. You can see here every client for which you are going to work, they will give you the training about the practice management software. Also, they are taking service of one of the EDI application. This is the third party application and it is used for scrubbing the claim. That means if consider that for time being, you can consider there is no EDI application and directly from practice management software, we are sending our claim form to the insurance. Multiple ways are there to send a claim form, right? Electronic way is the preferred way. Paper claim, that means through courier company, we can send the claim form. Fax is also there and some insurances, they are having option to upload the claim form on their website. Okay, so most preferred way is the electronic because it is the fastest way and charges are less for submitting the claim form. Not the free of cost. Every claim form is the unique claim form and there is a charges. We'll discuss that how much charges are there and but the fastest way and the preferred way is the electronic way. Okay, so from our practice management software, if you are directly sending claim form to the insurance, there is a standard time frame to process the claim. Okay, like we can consider 3 days to 15 days they are taking to process the claim. So consider that we sent our claim form to the this insurance company. They have taken a 15 days and after that they sent a rejection or the denial as policy ID is invalid. Again, we'll do a work. Maybe we are taking 1 week to do the correction. We are sending again to the insurance. They are again taking the 15 days and they checked and some invalid information is there or some missing information is there. Again, they are rejecting or the denying the claim. Again, will take. So it will take too much time for small mistakes. Okay, to get the payment. So instead of that, we are taking help from the third party application where we can set some rules. Some standard rules are there, and as a provider, we can also set some rules so that whenever we are sending claim form from our practice management software, it electronically, I'm talking about the electronic way. So it has to pass from the EDI application. So many EDI applications are there. I'll give you the list of EDI applications. Okay, like Trizeto is there. Okay, NextGen is there. So many applications are there, and one of the application service, anybody can take any application service. They just have to integrate their practice management software with these applications so that our claim form will go to the EDI first. It will check all the rules. That checking claim form is called as scrubbing the claim and everything is correct, then only that claim form will go to the insurance or else it will stuck into the internal EDI, that is rejection, internal rejection. There is a separate team who is working on the rejected claims. You can also apply for EDI department. They are purely working in day shift. Okay. And if everything is correct, then only it will go to the next level. And insurance also don't want to accept the wrong claim form. So they are also taking help. They are also taking some service from another EDI department. They are also setting some rules here. And the claim form have to pass from that. If not, then it will reject. So that is called an external rejection or insurance side rejection. It will come to the EDI only and our EDI team will work on the internal and external rejections. Okay, and everything is correct, then only it will go to the insurance. If consider that we build our claim, it has been in a single attempt, it has been passed from our clearinghouse, it is passed from insurance clearinghouse, it is reached to the claims department at insurance. So such kind of claim is called as clean claim. Okay, and whenever insurance company is processing the claim, they are having multiple options to send us a receipt. That receipt is called as explanation of benefit, where all the details are there, how they process the claim, how much they are going to pay, how much is the patient responsibility. Okay, is there any denial? Okay, partial payment, full claim has been denied. So multiple scenarios can be there, but they are generating one EOB and the claim form. That EOB they are sending through paper or the electronically or the fax. Okay, multiple ways are there. So most preferred way is the electronic way. So they are also sending that receipt through electronically, and it is coming to our EDI. And from our EDI, we are posting that into the practice management software. Some companies are sending on our billing address through courier company. They are called as EOB. And if electronically EOB is coming, then it is called as electronic remittance advice. Both things are same, only the way how it is receiving. Okay, so this is the way how we are sending claim form electronically and how we are receiving the electronic remittance advice. Send a email. What is the important thing? Email address. If any small mistake is there in the email address, then that email will go to the wrong email, right? Or maybe it will not go. Same thing is here. If you want to send a electronic claim, we should have the electronic payer ID for that insurance. The 5 digit, 6 digit number is there on every insurance ID card. That number is available. I'll show you the ID card, sample ID card, and then you can see payer ID is available on every insurance ID card. And we have to use that payer ID to send the claim form electronically. If you are selecting wrong payer ID, then it will go to the wrong insurance or wrong department of that insurance. Okay. That is the main important thing. If we want to submit a electronic claim, we should have the correct electronic payer ID. Okay, and to submit the claim form, will be a timely filing limit as well. We'll discuss that later. And if we want to send a claim form through paper, through courier, then we should have a correct claim mailing address, or else it will go to the wrong address. So this is about the process how we are going to send the electronic claim. Any question here, Praveen, Deep?
No, sir.
Okay. Don't worry, you can ask any question. Very few companies are having option. Consider that we are sending claim form multiple times. Okay, from last 3, 4 times we submitted claim form, but insurance is not receiving. Maybe paper claim we are sending, it is they are not receiving the claim. And now the timely filing limit is very near. So what we can do in that? We can talk to the insurance. They are saying that they have not received the claim form, but address is same. What is the technical issue? We don't know why they are not receiving the claim form, but the time is very less. Like 15 days is only the time frame pending to submit our claim form. So in that case, we can ask them, can we submit our claim form through fax? If they are sending yes, then definitely we should send our claim form through fax. Okay, some insurance company they are having option to upload our claim form on their website. Very few companies. Okay, so these are some options to submit our claim form to insurance company. So after processing the claim, okay, they are creating a receipt. As I said, EOB, that is explanation of benefit, also called as explanation of payment. Both are paper, and if it is receiving through electronically, then it electronic remittance advice. Bulk EOBs are there, like multiple patients EOBs are there, like 50, 60 pages are there, and hundreds of patients are there. It's a bulk EOB or the bulk ER. How the insurance companies are paying to the provider. Once they process the claim, it is not mandatory that if they process the claim, that means they are going to pay. No, depend on the patient's plan, what kind of benefits are there, and the provider contact and all. So consider that one claim has been sent and insurance want to pay to the provider. Okay, so how they are paying? So multiple ways are there how the insurance company is paying to the provider. Most preferred way is the electronic fund transfer. It is the fastest way. On the same day, amount will get credited into the provider's bank account. Okay, and it is the safe. Okay, there is a proper way to get registered with the insurance company to get the payment through electronically. Okay, multiple forms have to fill. Okay, and it will take 1 month maybe to get approved, and after that only they will start to pay through electronically. And in future also, for every claim they are going to pay through electronically. In paper check, the problem is if paper check they send to the wrong address, it will not come to the provider. Okay, so that's the reason every provider prefer to do the contract with the insurance company about the electronic fund transfer. Okay, they are doing setup with the insurance company so that they will get a payment through electronically. Paper check means hospital or the provider is getting the paper check on their address. It will take 10, 15 days to receive, again 1 or 2 days to clear that into the bank. So It is taking long time to get a payment into the bank. There is a third option. It's a virtual credit card, and I guess 0.5% insurances are there who are using this option, especially worker compensation. Small insurances are using virtual credit card. So it's a one-time usable credit card. Okay. So virtual credit card. Name is virtual credit card. Okay. So they are just sending the copy of the credit card. It's a one-time usable, and whenever provider is using that whatever insurance want to pay like $1,000, that will credit into the bank. Okay. That is the virtual credit card. Very few time we can see this scenario like insurance is saying that they paid through virtual credit card. Okay. So this kind of EOB is there. We'll see multiple EOBs. Okay, don't worry. We are having access for ability. So we'll show you multiple EOBs according to the scenario. Okay, so that you can get ideas. So this is also one of the sample EOB you can see. Insurance name, patient name. Okay, check number, EFT, date of service, procedure code, how much we have billed, how much is the payment, what is the denial reason and all. So we'll have the separate sessions for understanding the EOB and the components of the EOB. Okay, so don't worry. So what's the next? Some pros and cons are there, right? For the US healthcare. So pros means advanced technology, everybody is digitalized. It is very good that they are able to save or keep the record for the patient for long time. Okay. And if any patient is going to another hospital as well, they can request to the old hospital to share the history reports. Okay. After 5-10 years also, if the patient is going to the hospital, the records are there. That is the pros, right? They can choose the provider according to their like not in the India. In India, if you are going to any doctor, hospital, which is not contracted, which is not linked with your insurance, then you have to pay from your pocket. Maybe sometimes insurance is not going to cover the services. Okay. Or very few amount they are going to cover. But in US, uh, even though you are going to the non-contacted provider, then also their responsibility is to deal with the your insurance to get the payment. Okay, high quality care. They are maintaining everything in very detail. Okay, not like India. Okay, so these are the some more advantages are there. Not only this, and what is the cons? Just because they have to maintain everything digitalized. As I said, these applications are very highly rented applications, right? The cost is increasing because of these using technologies. Okay, and the cost have to pay hospitals only, and that is the reason the they are charging more bills to the patient to cover this cost. And this is also one of the reason the services are expensive in the US. Okay. In India also nowadays we are using the applications. Okay, I am using online appointment applications. Okay, like Practo. Some more applications are there in India as well. Okay, but because of that, obviously the doctors are charging 100, 200 extra amount for that in the fees. This is the cons. Okay, unequal access means some limitations are there in some policies. So like as I said, so many policies are there where limited benefits are there. So they have to go to that particular doctor, particular specialty only. Okay, or particular contracted hospital according to their plan. So depend on what kind of plan it is taking. According to that, definitely benefits are less and more. Okay, complex billing. These many departments are there. They have to do a proper way. Okay, we cannot directly create our own claim form. Okay, total 13 departments are there in the RCM cycle. So hospital have to create these many department, or they have to outsource all these things to the other company. And because of this also they have to pay these companies for maintaining all these departments, right? So that is also one of the big reason that the services are expensive in the US, right? So this is only the first session. Okay, so according to the notes we'll go, I have shared the part 1. 1 second guys. So what you have to do? You have to start to read the notes. I have kept it on Drive. So this is the part one. So what you can do from today, whenever you are getting some time, the same notes is there. Okay. So this is having 54 pages. If you get the time, you can print it. Okay, that is good and well. Okay, we are not here for long time. Only 1 month training is there, so it is good that you can spend some more 100 200 rupees for taking the printout and go through these notes. And session wise, we'll take all your sessions. Yes, Deep, you are having question.
No, sir.
You are comfortable, right?
Yes, sir.
Whatever we covered till now.
Yes, sir.
प्रवीण कुछ पूछना है आपको?
No, sir, I am comfortable too.
ठीक है, तो आई एम स्टॉपिंग हियर.